The Health Innovation Hub will make a tangible difference to our region. It's vital that we work together so that we learn how to do more differently. We want to challenge ourselves and each other to transform lives, to create opportunities and to improve health outcomes for all.
The Health Innovation Hub here at the University of Brighton will make a tangible difference to health outcomes. Because it is concerned with innovation, we are creating radical solutions that are needed to some of the most significant health challenges that we face in the world. That can only be achieved if we bring different disciplines together, if we work closely with clinicians as academics, if we work closely with patients. That is precisely what the Health Innovation Hub will facilitate. We're also training the future workforce. That workforce needs to be equipped with the very best skills, underpinned by cutting-edge research. That is what we're doing at the Health Innovation Hub.
So this initiative, this collaboration with the university and the institute, what really it's allowed us to do is to come together as system partners and pharmacy leads to jointly work together to develop what we feel is the support that's needed to support the education of the pharmacy workforce, to develop the pharmacy workforce, to really be able to deliver safe and effective use of medicines in Sussex. And more importantly than that, also, it's not just about the education, it's about the innovation that we need to embrace and developing those research capabilities. So working with the university and through the institute, developing those skills and identifying what those priorities and needs are for Sussex around medicines research and how the pharmacy workforce can support that.
I'd summarise working in partnership is absolutely essential. I think the way that the world is evolving is that we have to rely on each other's skill sets, and I think working with NHS Sussex and the ICB has enabled us to build relationships across the whole region between different sectors that really we wouldn't have been able to do before, and what that's allowed us to do is develop a shared vision for medicine's use so that we can improve patients' experience and just achieve that excellence in clinical care that we all really want.
The Health Innovation Hub can actually offer significant impact and support to the healthcare industry. One, it will help us to deliver our strategy in Sussex, our healthcare, called Improving Lives Together, i.e. improving the lives of the local population, and also sharing learning beyond Sussex. Number two, it would allow us to have, I would say, cutting-edge responses to the ongoing challenges that we face. And as the population dynamics, the environment and the context changes, research will ensure that we're on the front foot of actually responding to health care needs. So the Health Innovation Hub, I would say, is timely. This is the time where only partners coming together in partnership can respond to the challenges we all have. The collaboration between the Health Hub and those on the front line will actually bring lived professional experience, research, evidence base together.
I think one of the best things about working with external organisations around health research is the fact that you get a chance to do interdisciplinary working, and that means that you get people who think very, very differently to you with very, very different skill sets, and that can only complement and improve the quality of the research and the outcomes and the impact that research has on our local communities.
I think for me, one of the key things that we will need to consider going forward is what do we do with an older population with potentially less public sector resource. So bringing people together, working out how we collaborate on these problems together, using evidence, using science together is one of the key things I would like to see the hub do.
One of the great benefits of working with a research collaboration hub is that the partnership it provides really helps us do meaningful work that can have a direct impact on the communities within which we serve. And for universities that's really important because we want our research to be translatable, for it to be meaningful and ultimately to improve the health and lives and well-being of our communities.
One of the key things about the Health Innovation Hub is it's not focused on a single research area, so there's no siloed practice here. We're welcoming researchers, health professionals, industry, policymakers and community groups working in the field of human health and keen to make a step change in health outcomes. Discover more about the Health Innovation Hub by visiting the University of Brighton website or send an email to find out how we can work together.